everyone. My name is Maria Teresa Beniga. This is my TeachOne presentation where I will discuss a risk assessment analysis using a receiver operating characteristic or ROC curve. The objective is to determine whether age can predict whether a patient will live or die. So the purpose of this analysis is to evaluate age as a predictor of mortality. We use several age cutoff values. If a patient's age exceeds the cutoff, we predict the patient will die. If the age is below or equal to the cutoff, we predict the patient will live. So this table summarizes the data set. The age groups are represented using midpoint values, 45, 55, 65, 75, and 85. There were 143 patients who survived and 63 patients who died, giving a total sample size of 206 patients. Before performing ROC analysis, we calculate sensitivity and specificity. Sensitivity measures the ability to correctly identify patients who died. Specificity measures the ability to identify patients who survive. For the cutoff age of 40, all patients are predicted to die because every age group is above 40. This gives perfect sensitivity of 1.00, but specificity becomes 0 because no survivors are correctly classified. For the cutoff age of 50, patients older than 50 are predicted to die. Sensitivity remains very high at 0.952, but specificity improves slightly to 0.231 because some living patients are now correctly classified. At the cutoff age of 60, the balance between sensitivity and specificity improves further. Sensitivity decreases slightly to 0.873, while specificity increases to 0.441. For the cutoff age of 70, the test achieves the best overall balance. Sensitivity is 0.762 and specificity is 0.685. This cutoff produces the highest combined value of sensitivity and specificity. At the cutoff age of 80, the specificity becomes very strong at 0.860, meaning survivors are classified more accurately. However, sensitivity drops to 0.524, meaning more deaths are missed. For the cutoff age of 90, nobody is predicted to die because no age exceeds 90. Sensitivity becomes 0, while specificity reaches 1.00. This summary table compares all cutoff values. The largest value of sensitivity plus specificity occurs at age 70, with a total of 1.447. This indicates the best predictive balance. The ROC curve plots sensitivity on the y-axis and 1 minus specificity on the x-axis. Each cutoff value contributes 1 point to the ROC curve. A curve closer to the upper left corner indicates better prediction performance. This ROC curve shows how well age predicts whether a patient will live or die. The axis represents the false positive rate and the y-axis represents sensitivity. Each point represents a different age cutoff value. The curve demonstrates the trade-off between sensitivity and specificity. The ROC analysis demonstrates the trade-off between sensitivity and specificity. Lower cutoff values capture more deaths but incorrectly classify more survivors. Higher cutoff values correctly identify survivors but miss more deaths. In conclusion, age is a useful predictor of mortality in this dataset. The optimal cutoff age is 70 years because it provides the best balance between sensitivity and specificity. Thank you very much.